for recording the meeting for us. I'm the Deputy Executive Director over Policy Operations and Compliance at the Department of Community Health, and I have been the EVV lead for about 4 years now for electronic visit verification. I want to just take a moment at the start to thank y'all for joining us and thank you for your continued participation with the electronic visit verification program. It has been absolutely positively the biggest help that we've had with instituting this federal mandate is having provider, member, fiscal intermediary input along the way to ensure that we are implementing the program in a way that complies with the federal mandate, but is also functional and a value to our state and to the members that we serve. So we start every presentation with the mission of the Georgia Department of Community Health, which is to provide Georgians with access to affordable quality health care through effective planning, purchasing, and oversight. So what are we going to go over today? So this slide gives you a little bit of a view into what we're going to be talking about today. So we're going to be doing an EVV operations update. We are in operations for phase 1 of the program. We're going to give you some common issues and frequently asked questions that we hear either through the GA EVV call center or the DCH EVV mailbox, or just questions that come to me and different members of our staff as we reach out to you. We're going to talk about phase 2, which is the home health care services EVV implementation. We're going to give you an update on third-party vendors. We're going to give you some information on how best to contact the call center. And then we'll do a little bit of a Q&A as time allows. So let's start off with the EVV operations update. The big news in operations, and one of the things that Ryan Loke said at the beginning at the start of the Medicaid fair, is that our EVV system was certified. And that is really big news for the state of Georgia. So our phase 1, the personal care services component of EVV, has been certified by the Centers for Medicare and Medicaid Services. And that helps at the federal level and the state level with financing. It helps with outcome. It helps with evaluation because we get CMS support on that. And we also start submitting key performance indicators to CMS on a quarterly basis that shows how we are doing with the EVV service, with the EVV program. Now, it doesn't mean that the federal government is saying, hey, your EVV system is 100% great and everything is working perfectly. But what it does is it acknowledges that the core components of the EVV system are met according to the 21st Century Cures Act, and that they feel that from an implementation standpoint, that they can certify the system. We are one of a very few, less than 10 states in the United States that have reached certification. So it really is a bit of a big deal because we're on the forefront of EVV in the state. So I like to give some key statistics because I think this is important. A lot of times I hear from providers that, hey, we're having just terrible problems with the EVV system. I don't think it works. So I want to, everybody, and I appreciate that if you're a provider that is struggling or you're having some training issues, but I like to give a larger view of the program so people understand that that's not really everybody's reality. So 86% of personal support services and community living support services were billed successfully through EVV in December 2021. That's from capturing the visit all the way through to GAMIS paying the claims. 86%, sorry. That's a very high number, right? Only 14% were billed directly to GAMIS and not through the EVV system. We have had over $2 million since we got up and running in April of last year. We have had over 2 million visits, not dollars, 2 million visits completed in the EVV system. So more than 2 million clock in and clock outs have been done through EVV. Also, We have had over 1 million claims submitted from EVV to GAMUS and appropriately paid. So that is really, really great. So over 1 million. Are we having trouble seeing the presentation? Can y'all verify that you can see the presentation for me, please? I'd hate for y'all not to see the presentation.
I can see it. Someone said that they couldn't earlier, so I was just double checking with them.
Okay, great. Thank you. So you're on the key statistics page with me, right?
Yes.
Thank you very much. I'm so glad you're here just to make sure we're on point. Okay, so where are we with PSS? So we started April 1st, 2021 with making the system go live. In November 2021, we made it a policy requirement for PSS and CLS claims to be captured in EVV and sent through to GAMUS. So by policy, if you're not doing that, you're not complying with EVV and you're subject to auditing and recoupment unless you have one of the exceptions, and we'll talk about that in just a minute. January 1st, we put on a mandatory claims edit that prevented you from billing directly to GAMUS. We have since changed that mandatory claims edit to a pay and report edit, where if you have a tier 2 ticket or a tier 3 ticket with our call center, the claim will pay. It posts an edit in the system that says, hey, this claim should have been billed through EVV, but it continues to pay. And then it kicks out on a report for our staff to verify that it is a valid case to bill directly to GAMUS. So I said there were some exceptions to having to bill through EVV. And right now there is only one exception. And that exception is if you have called the NetSmart call center, the conduit EVV call center, and we'll have that information at the end of this presentation to make sure you have it. And that call center has opened a tier 2 or tier 3 ticket. They can't solve your problem while they're on the phone, and it requires research within the system. They will open a tier 2 ticket for you. They will tell you the number of that tier 2 ticket. And then at that point, you can bill through GAMUS for the individuals you have called about that are associated with that ticket. So there is no reason why you can't still continue to get paid if there is a missing member or a missing PA and you have taken the appropriate step of calling the call center to get that tier 2 ticket open. Don't write me directly or write the EVV mailbox at the end of this page directly. You need to go through the EVV mailbox, and I'll give you that in just a minute. It's part of this presentation. And that's important because if you write me directly or the EVV mailbox that DCH manages, we're just going to send it to the call center. We need those tier 2 tickets so we can monitor contract compliance with our vendor and so that we can make sure that we don't have a systemic issue within the EVV system that needs to be fixed for all providers. You guys are our first warning defense for us. So if something goes wrong, you're the first person to tell us, hey, there's something wrong out there. I do also want to let you guys know that initially we were allowing you to bill GAMUS for patient liability or cost share members in CCSP and Source. That has been fixed. The system now appropriately calculates cost share in EVV. So there is no reason for you to not bill and capture your visits for individuals with cost share through EVV. If you continue to bill those people through GAMUS and not use the EVV system, that is subject to audit. Sorry, thing got out of whack here. There we go. All right, so now let's talk about EVV operations and common issues and frequently asked questions. So rounding rules. We continue to get a significant amount of questions around rounding. As a result of EVV, you all asked us as a provider community to institute rounding for CLS and PSS. And we took the standard Medicare rounding rules, the federal government rounding rules. So 8 minutes is rounded up, less than 8 minutes is rounded down. For those services where it's 30 minutes or more, that rounds up to an hour. If the service is an hour and it's less than 30 minutes, it rounds down. I'm going to give you some examples of that because we get an awful lot of questions around this. So if an aide clocks in at 12:58 and then clocks out at 3:10, that's a total of 2 hours and 12 minutes. So they're going to get paid for 9 units there. They're not going to get paid for 8 because 12 is more than 8, right? And so it's going to round up. Same aide clocks in at 12:58 the next day for a 1 p.m. meeting, but they clock out at 3:05. Now it's only going to be 2 hours, right? Because that's 7 minutes. So this equals less than 8. Less than 8 is rounds down. So it equates to 8 15-minute units or 2 hours. So the manual adjustment of schedules option in EVV NetSmart allows you to correct those mistakes of clock in and clock out. But you should be paying your staff for the time they work. That's a Department of Labor issue if you're not. Now, you need to be having that conversation with your staff member and the member that you serve as well, right? Because in the rounding rule example 1, if the member, Brian Dowd, is supposed to be getting 8 units every day, and I'm getting 9 units every day, at the end of the month, I'm going to run out of units. There may be a day where I can't get service at all because I have run out of units because I'm working an extra 15 minutes every single day. So it may be valid, but that aide needed to be there an extra 15 minutes. But if not, you need to be having that conversation with your members. So we get a lot of questions into the EVV mailbox that are about adjustments or paid or partially paid claims or why a claim is denied. Claims processing through GAMIS did not change. The EVV system captures its components, makes sure that a prior authorization, valid member, valid provider is there. Then it sends it over to GAMIS. GAMIS still goes through all of its appropriate claims editing. And you should be able to see what that claims edit is denying for. If not, you can call the GAMIS provider line and they can help you walk through that. If you're still having issues, you can write me. We have deployed a lot of provider field representatives with GAMIS who have done an excellent job of walking providers through common billing, common editing, common reasons why their claims are denied. Another question we still get a lot is, hey, my aide and my member is saying that they're clocking in at the member's house, but it's showing them 10 miles away. So you can call the NetSmart call center, and the NetSmart call center will walk them through to make sure that their cell phone is correctly calibrated and their GPS is on correctly. Again, we are getting a lot right now. What we're getting with tier 2 tickets and concerns about the EVV system is almost exclusively about missing members or missing PAs. If you have missing members or missing PAs, please make sure before you contact the call center that they have an appropriate aid category within GAMIS and that they have a PA within GAMIS that shows you as the provider. We're getting a lot of complaints to the EVV call center with saying, hey, I don't have a PA for this member. And when we're going in and looking, the member is out there with a QMB only Medicaid or a specified low-income Medicare beneficiary, SLIMB only Medicaid. And they haven't had that waiver category of Medicaid added to their case. Likewise, we're getting a lot of providers who are calling us and saying, hey, Brian's now with my agency. Well, when we go into GAMIS, we're not seeing that switch from their old agency to you. Once that switch is made, that should transfer over from GAMIS to the EVV system, within 3 business days. If it is not, that's when you need to call the call center to say, hey, it's been 3 business days since this is in the system. I can see the PA in GAMUS. I can see the member has the appropriate Medicaid. There's something going on here. If EVV can't fix it immediately, they will open a tier 2 ticket, and that will allow you to immediately bill through GAMUS. Hold on. I got an issue here with my computer, so give me just a sec. Okay, the claim submission deadline. The claim submission deadline has not changed for EVV. So, has not changed for GAMUS. So if you're billing correctly for GAMUS, that's Friday at noon. But it has changed for EVV. You have to have all your claims into EVV by Thursday at midnight to get paid the next week. Rate increases. Getting a lot of questions about rate increases. So we are still in the process of doing the mass adjustment for the 10% rate increase for EDWP and ICWP. Guys, it's over 1 million claims. It's 1.2 million claims. We have a pre-proof that's out there. We're making sure everything's okay. We're actively working on it. I don't have a date for you for going back to July 1st for those at this point, but please be assured that we are working on it as quickly as possible. Okay, so also, I want to point folks to where they can get help with GAMUS. So this link, this will be available on the GAMUS website, but this link will take you directly to questions that you can submit to them either through calling or through email where they can respond to you. GAMUS functionality continues to include a remittance advice, which is where you get a listing every single week of what claims were submitted, what their status are, and what paid. You can go on and look at claim status in GAMUS, whether it's paid, denied, or suspended. You can void and adjust claims in GAMUS. You can look at your prior authorizations and your service units through GAMUS. Okay, let's talk a little bit about the home health implementation. So as part of the 21st Century Cures Act, the EVV system was implemented in 2 parts. The first part, which we're in operation for, is PSS and CLS. The second part is for home health, and that's just category of service 200 and just for home health providers. It's not for skilled nursing that exists in GAP. It's not for skilled nursing that exists in hospice. It is only for category of service 200 providers for home health. We have also very recently learned, that CMS is allowing an extension to this January 1st, 2023 deadline. They're extending it to January 1st, 2024 if the states submit a good faith exemption requesting that they get another year to implement. The Department of Community Health is reviewing that right now. It's very likely that we will ask for an extension. I don't know that we'll ask for a whole year extension, but we want to have time to be able to do these 4 things: register home health providers, provide training, do a soft launch, and then be ready for whatever the mandatory go live is. We want to be able to take the exact same steps we did with part 1 of EVV to ensure that we are able to get the system up running with as least amount of impact to providers as possible. Right? We love to give y'all a third-party EVV vendor update. So this is really important. So if you are a private company that has your own EVV system and you want to be integrated with the Georgia's EVV system, you need to sign the attestation by today, if you're not already integrated with us, letting us know you plan on integrating. And we need you to be fully set up within the system by June 30th, 2022. Right now, we have 35 options for complying with EVV. And that includes the NetSmart system, which is the state-funded free service. So all of these folks are already integrated with us, and as a provider, you can choose to use them, or you can choose to use the free NetSmart system. So you have many, 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 many options out there to be able to use the system. So we may get a couple more here between now and the end of June that you are able to use, but this is a whole host of providers that you can use and that we can. So I promised you I'd talk you through how to contact the call center. This is their number, 833-701-0012. About half of the folks who are contacting them by phone. The other half are using their EVV mailbox, GAEVV support at conduit.com. There is also a live chat if you want to chat with a representative to go through your problem right there in real time, and that's at www.gaevv.com. When you do contact any of these methods, make sure you have your agency name, your agency provider ID, your NPI number, your EIN number, your contact email address, and callback number. If you have a missing PA, make sure that you have looked in the PA system in GAMUS and that you have that PA number for them. Make sure you've checked that provider member enrollment just to make sure that you have that as well. Okay, so we're going to stop now. We're at the end of our presentation to do any Q&A you may have. I'm going to leave up the call center information for EVV. Again, guys, this is how you guys get those tier 2 tickets if you're having a problem so that you can bill directly to GAMUS and not have any disruption. That is a banner message that is out there that also outlines this process for you. And I believe it was put out there January 9th. So you can go out to that banner message, look at that, and it will also provide you these resources. So no need to furiously copy them down, but you have them if you need them. Okay, I'm going to go through some Q&A now. I don't currently see any Q&A. So I'm going to give it just a minute because we're way ahead of schedule. We're at 9:24. I'm going to give it just a minute if you guys have any questions. If you don't, we'll go ahead and close out the session. I do want to thank everybody for joining me today. You guys have been great in the process of helping us identify problems, concerns, issues, and you are absolutely positively one of the reasons that we are one of the first states to be able to certify our EVV system. And I say that to CMS and every other state I talk to.
Brian,
Yeah.
there are a couple of questions. I'm going to try changing your role to host to see if you can see the Q&A.
Okay, because all I got is, yeah, okay.
Hold on one moment.
Oh, yeah, 7 just showed up. Thank you.
No problem.
That's awesome. Thank you so much. Will Medicaid be giving a rate increase due to inflation? So there was a 10% rate increase that was part of the public health emergency. We do plan on making that rate increase permanent. So, and you guys need to know, the Medicaid agency itself doesn't generate revenue, right? So we're not like an insurance company. We don't have money that we can pass out. That comes from tax dollars. So any of our rate increases have to come either from legislative appropriation or from something we do like a rate study to look to see if the rates are appropriate. Why do I see added ICD-10 codes in some of my clients' profile and TELUS? That's a great question. So we get our ICD-10 codes directly from the prior authorization. So whatever case management had put on your prior authorization that authorizes the member's services, those all come across, and they may put in 3, they may put in 4. You may have originally just been using 1, but we're getting all of them when the file feed comes across. And I understand that some third parties are having issues with that. If you do have issues with it, you would need to call the call center to make sure that they are able to fix whatever it is and work with our integration team. Again, I have a question that says if you are using a third-party vendor and they cannot seem to fix the location issues, you should call NetSmart to figure out what it is, just to make sure that it's not something on our end with integration and that we have a ticket opened up. But that does not, we can't manage your third-party vendor choice. If they continue to have issues, then it becomes incumbent on you to make a business decision as far as, okay, do I want to continue with a provider who's not providing the services that we need? Voids and adjustment can still be done through GAMUS for now. That is correct. EVV is not for skilled nursing. I had a question that asked, is EVV for skilled nursing? And the answer to that is no, it is not. A question is, when speaking about clocking in at different locations other than the client's house, can you repeat that information again? I misunderstood. Will we have to calibrate each individual's phone? Absolutely not. What I was saying there is that what happens is that sometimes people have something messed up on their phone, and it doesn't appear that when they clock in, it's accurately capturing their location. Our call center does know how to help the individual go through their phone and make sure that their system is working correctly. You can clock in and clock out at locations other than members' home. We understand that not all services start in the member's home. They may start at an adult day health center or otherwise. You even have the option within EVV to add in known alternate locations, or if it's just a one-off thing, you can put in a reason code in the administrative portal. The next question is, how do you bill for DME supplies and equipment? That is not an EVV service. It does not go through EVV at this time. So you bill through GAMUS like always. Who do we contact about denials with ICD-10 codes? You would need to make sure that the ICD-10 codes are correct in the system. We do not allow for unspecified ICD-10 codes in Medicaid. We have never allowed for unspecified ICD-10 codes. So if you are getting those from case management and that's the only code you're getting, you're going to need to contact case management and make sure they're giving you a valid ICD-10 code. If there are multiple codes in the system and it's a problem with what's coming across, then you can contact this EVV call center. They will work with you or the integration provider to make sure that the appropriate codes are coming across that are valid. But I'll give you an example. I got an EVV. Some member contacted me, a provider contacted me and said, "Hey, my ICD-10 code isn't working." The only code that was entered into the system was unspecified hip pain. That's not an unspecified code is not a valid ICD-10 code. And if hip pain is the only diagnosis, I'm questioning whether or not that individual is even appropriate for the waiver at all. I'm guessing they are. And what happened is the appropriate ICD-10 codes weren't entered, and that needs to be corrected. Already answered that one. We are hoping one day all of our nursing visits and home place clients through EVV. Will that be possible in the future? Well, we haven't talked about adding new services to the home and community-based services at this point, other than the ones that are federally mandated. And we have talked about some state plan services adding, but we can certainly consider any expansion you guys think may be beneficial to you. Absolutely. So I will take that back to our leadership. Address the unspecified diagnosis codes. Again, you need to work with your case management to get unspecified diagnosis codes as specified. Okay, one more question here. Yeah, I'm also having issues when my third-party vendor sends the visits over. I'm not seeing those claims in TELUS. When I call EVV, they will tell me to contact my vendor, and it is a back and forth motion. If you we can't manage your third-party vendor, right? So you're going to need to make a business decision here. You're going to need to make a business decision as to whether or not you're with the right third-party vendor. Our folks should be able to identify if it's an issue on their end. If you want to send that directly to me, I will let you know if it's an issue on our end. If it's not an issue on our end, then you're going to either need to move to the free NetSmart system or choose another third-party vendor that can accommodate the EVV system. Alrighty, I'm going to wait just another minute. I think that's all our Q&As. I do want to let you know that the EVV mailbox is open, and you can feel free to respond to any other questions there. Medicaid can't give more than anything we're legislatively allocated for. I appreciate your concern, but that's how rate increases work. I'm going to go ahead and type my email address out here so you all can have it. And that, I think we're going to close out because I think I've gone through all the questions. So you should have my email address out there now. It's just my first initial and my last name, BDOWD at dch.ga.gov. Again, it's BDOWD at dch.ga.gov. Again, want to thank everybody for their time. We're going to close out the session today. It's been a pleasure talking to you, and thank you for your continued support to our members and through the EVV process. Have a good day and have a good rest of the Medicaid fair.
Thank you, everyone, and thank you, Brian.